an average size male or female, what would their caloric needs be on a daily basis?
Well, a good rule of thumb, well, of course, it all depends what type of activity. If the more active you are, the more you will need. So, so basically, if you have a person that's 150 pounds, a male, and you multiply by a factor of 11, you'll get approximately the amount of calories that they should have as baseline. So 11 times, 10 or 11 times 150 pounds would be 1,500 to 1,600 calories. That's really without much exercise. So you would have to, what I do is I have a little scheme where if a person is relatively inactive, I may add another 100 calories for the day. So that would be 1,700 calories. If they're moderately active, 200 calories. If they're very active, I may add 400 calories. So that same 150-pound male could have an appropriate caloric intake anywhere from 1,500 to 2,000 calories and not gain weight.
And of course, most people know, but to emphasize that something like a can of soda or even a cup of cranberry juice cocktail, which you think, oh, this is a juice, that's good. There's enough sugar in there so that it's somewhere between 120 and 160 calories, depending on which brand or type that you're drinking. But you're talking about, you know, maybe 10 cans of Coke a day would cover your caloric requirements for the day. That's pretty intense. And when you talk about people going to 7-Eleven, getting a big gulp, which could be 500 calories in one thirst-quenching drink, and they haven't even eaten yet.
Well, I should actually qualify that 1,500 to 2,000 calories for that theoretical 150-pound man is not all carbohydrates.
Right.
So there's actually a kind of a recommended ideal proportion where maybe 40% of the total calories comes in the form of carbohydrates, 2/3 of those being the low glycemic index, and then we want about 30% protein and 30% of what we refer to as healthy fat. So that's how the 1,500 calories are distributed. The 10 cans of Coke, that's all carbohydrates, so that's way off from anything that would be close to be appropriate. I tell patients, by the way, that calories should be eaten and not drinking or drunk, and so basically I feel that one of the first places that you can eliminate excess calories is just get rid of the liquid calories. Start with the liquid calories. And so, you know, you can have diet sodas, although too much diet soda now may actually make you heavier because there may be some impact on metabolism with some of those sweeteners. So when it comes down to it, basically water or sparkling water is probably the most effective or the most safest liquid for people who need to lose weight.
And protein, people tend to think that they need a lot of protein. What is a general rule of thumb in terms of an adult and their protein needs? Well,
as I mentioned, about 30% of their total daily calories is a reasonable amount. Now, most Americans are not getting 30%. They may get the so-called standard American diet, SAD, is basically 88% fat and sugar and 12% protein. So starting there at 12% protein, you know, getting to 30% or 25% protein is a big move for a lot of people. I find that it is the protein content or the total amount of protein that is the hardest to get people to eat. And people tend to know that a food has protein in it, but they don't know how to quantitate it. And there are simple tools available to help you figure out, you know, in a particular meal, if you have a few ounces of meat or chicken, how much protein is actually in that.
Okay. And most restaurants now will give you that breakdown. And on the whole, you need about, what, 1 to 2 grams of protein, depending on your activity and age,
per ideal body weight.
Per kilogram of weight. So if you're 150, that's a 70-kilo individual. 70 grams of protein isn't a lot of protein. I mean, it's not a lot of food either, per se, depending on the quality of the protein.